Welcome to the all viewers and well-wishers of the word. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it's the time to return a lot to the word from where I am. The topic of today is Stye or Hordeolum. Stye or the Hordeolum is also known as Stye or the Hordeolum, and stye is a pimple or abscess on the upper or the lower eyelid, mostly next to an eyelash. Styes can form deep inside the eyelid. It is a bacterial infection of an oil gland in the eyelid. Bacteria that live on the surface of the eyelid block an oil duct. Then it gets inflamed to form stye or the hordeolum. Other times, the germs and the dead skin cells get trapped on the edge of the eyelid. This results in a red, tender bump at the edge of the eyelid. Here one can see these styes on the external surface. The outside or inside of the eyelid can be affected, so-called external stye and internal stye. The internal ones are due to the infection of the meibomian gland, while the external ones are due to an infection of the gland of Zeiss. The cause of the stye is usually a bacterial infection by Staphylococcus aureus bacteria. An internal stye on the underside of the eyelid also causes red, painful bump, but its location prevents a whitehead from showing up on the eyelid, as one can see on the external stye. So here are the external stye one can appreciate on the outer side of the eyelid, and here are the internal stye which are on the inside of the eyelid. Now, first one should know the location of the meibomian glands. As you can see, these are present on the upper eyelid as well as on the lower eyelids. And here are the meibomian glands which one can appreciate here, and that is the skin of the lid, then orbicularis muscle, hair follicle, and perifollicular glands which are lying along the sides of the eyelashes. Now the glands of the Zeiss and the mole, that one can see that the eyelash, the above of that is lying the gland of Zeiss, and the below that is the gland of mole, and behind that is the gland which is called meibomian glands. And here one can see the stye on the upper eyelid, that is the infection of these gland of Zeiss and the gland of mole here, and also it involves the meibomian glands. Here again one can appreciate the gland of mole, that is just along with the eyelash, and the gland of Zeiss over the eyelash, and behind that is a big meibomian gland with multiple acinus, and that is just having a duct, and that is lying over the tarsum, and this is the so the stye or the hordeolum, some leave a small fluid-filled cyst that have to cut open and drain. Often a stye go away without any specific treatment in a few days or the weeks. To speed up improvement, one can use the warm compresses or antibiotic eye ointment may be used if the infection is more serious. There is little evidence for use in the internal styes, and used for the external styes only the ointment, antibiotic ointment. Styes may occur at any age, and styes come back, and this can be a symptom of other chronic skin problem which just favors the growth of the style or the ordealum. Happiness starts with you, not with your relationships, not with your job, not with your money, but with you. And the happiness starts from the inside of you. You feel the happy inside, and then you can express outside. Now, the cause of the stye, it is a bacterial infection, and bacteria usually are the Staph aureus in 95% of cases. The other are the streptococcus or other bacteria. The infection causes blocking of an oil gland at the base of the eyelash. Styes are present in people of all age groups, but mostly seen and triggered by the poor nutrition, sleep deprivation, and the lack of the hygiene. Lack of the water and rubbing of the eyes is also one of the factor which triggers this stye formation. Styes can be secondary to the blepharitis. Now, signs and symptoms of the stye. The first sign is a small yellow spot at the center of the bump that develops as pus and expands in area. Other symptoms are a lump on the top or bottom of the eyelid. It is a localized swelling of the eyelid, localized pain, redness, tenderness, crusting of the eye margin, and the burning in the eyes also. Here one can see the different symptom of the stye, and that is just the crusting, the pain, tenderness, and other symptom, tearing, and that is all the stye symptom which one is going to have, the swollen lids and extra. Then the sign and symptoms are drooping of the eyelid, scratchy sensation on the eyeball or the itching, blurred vision sometime, mucus discharge in the eyes, irritation of the eye, light sensitivity, tearing, discomfort during blinking, and sensation of the foreign body in the eye. Now, the complications are rare, but most frequent is the progression to a lesion, which have to be removed by the surgery. This causes cosmetic deformity, corneal irritation, and required surgical removal. Complications arise from the improper surgical lensing, the surgery done, and that consists of disruption of the lash growth, lid deformity or the lid fistula. Large styes may interfere with the one's vision, and eyelid cellulitis is another complication of the eye stye, but that is very rare. Here one can see the healthy eye and the eye irritation and the eyes with the blepharitis, and that is the glazion, meibomian gland obstruction, and the stye which is here. So these are all the symptoms due to that. Now, when a girl tells you about her problem, it does not mean she is complaining. It means she trusts you, and you have to keep her trust. Now, treatment of the styes. Most styes resolve on their own within 1 to 2 weeks, and the primary treatment is application of the warm compresses. Clean the affected eyelids with the tap water or with the mild non-irritating soap, or one can use the shampoo which is non-tearing shampoo, the baby shampoo, and to clean the crusted discharge, do gently while the eyes are closed to prevent the eye injuries. Here one can use the warm compresses on the eyes and also the baby shampoo that is safe for your eyes because it does not cause any tears. And the continued treatment is to avoid the eye makeup like eyeliners, the lotions, and wearing the contact lenses. That is also going to cause the styes. These can aggravate and spread infection to the cornea, and try not to lens eye themselves, but get the consultation of some proper eye surgeon. Pain reliever such as acetaminophen may be used, and these are the makeup tools and the kits which are responsible for spreading and promoting the styes. Antibiotics sometimes are used as antibiotic eye ointment like erythromycin, cetirizine and tobramycin, chloramphenicol or the moxifloxacin. But be careful, the chloramphenicol can cause aplastic anemia, which is rarely fatal. It is given to the people with the multiple styes not healing. So these are advised antibiotic ointment. People with the blepharitis or the rosacea can be recommended also the antibiotic ointment. Here one can see erythromycin ophthalmic ointment and there is the tobramycin ophthalmic ointment for the styes. Then one can use the chloramphenicol eye ointment or the moxifloxacin eye ointment. And the prevention is closely related to the proper hygiene of the eyes, proper hand washing upon awakening, application of a warm washcloth to the eyelids for 1 to 2 minutes will liquefy the contents of the oil glands of the eyelid and so preventing the blockage. Cosmetic eye tools should not be shared with others to spread the infection. Eye should not be rubbed or touched with unclean hands, and contaminated eye makeup should be discarded, and sharing of the washcloths or the face towel should be avoided. It prevents spreading infection between the individuals. Breaking eye will spread, breaking stye will spread bacteria contained in pus and should be avoided until unless some skillful hands can do it, and that is by the ophthalmic surgeon. Now, certain procedures are used to get rid of these styes: incision and drainage if no resolution. 48 hours after warm compresses, lance stye with a needle to help draining, and surgery is last resort in stye treatment. Under local anesthesia, make a small incision on the inner or outer surface of the eyelid where the stye is present, depending how stye is pointing. Now the pus is drained out of the gland. Very small sutures are used to close the lesions. Sometimes histopathological examination is done to rule out any skin cancer which can present like this. Here one can see the local anesthetic is given and the stye is incised and removed, and sometimes the stitches are applied also if the lesion is larger. And there are certain tips for treating the eyes, as I have already told you: the hot compresses, then the antibiotic tubes, and gentle massage of the area that can also give you the soothing. Alternate medicine is acupuncture that helps sometime, so one can use the acupuncture, and that is the way of using the acupuncture. And that is the end of the lecture. Hope you will like it and you will subscribe it, and please share it with others for the benefit of the others. And if any question, never hesitate to ask me. And thank you very much for watching.